I'm Eric Bartra. I'm a physician here in Lebanon County at West Cornwall Family Practice and a member of Lebanon County's Child Death Review Team and also the medical director for the state Child Death Review Team.
I'm Janet Bradley. I'm an assistant chief at First Aid and Safety Patrol, also the chair of the Lebanon County Child Death Review Team.
I'm Jeff Yocum, County Coroner.
Brian Smith, Executive Director, Chief with First Aid and Safety Patrol. Just here to support Janet.
Good morning, County Commissioners, and thank you for giving us the opportunity to present today Child Death Review. A child should not die, and when a child dies, the community needs to take notice. It should be a sentinel event in the community to understand why and how that child died and what can be done to prevent future child deaths. And that's the purpose of Child Death Review. We're here today to make you more aware of what Child Death Review is, what's going on in the county and across the state, and also so you know, so we can perhaps partner in future endeavors for prevention activities. Child Death Review is a concept started in the 1970s in California, initially around child abuse deaths. What they were finding was that there were things were not being discovered just from the normal procedures of why some of these children were dying. So a multidisciplinary group would get together to review a child's death, again initially around child abuse. Over the 70s and 80s, across that country, that spread into more states doing it, and it broadened to include more than just child abuse deaths. And then in the 90s, it's really took off where many states are reviewing all deaths. And in early 1990s, 1993, 1994, the Pennsylvania chapter of the American Academy of Pediatrics started its Child Death Review program with the help of a personal check from a surgeon in the Philadelphia area. And at that time, they were reviewing deaths, and again, the goal is prevention. The goal is not to investigate the death again or do any police work, but to come together as a community to understand why and how that child died, and then to take steps to prevent future deaths. In Lebanon County, like I said, Lebanon County initially had its team jointly with Dauphin County from the mid-1990s till 2003. The problem was we'd have our meetings sometimes early Friday mornings in Dauphin County, and the attendance wasn't that great from the Lebanon County participants. So in about 2003, Lebanon County broke off from Dauphin and started its own team. And in 2008, Act 87 was passed, and this bill codified child death review in Pennsylvania, mandating that every county have a child death review team. And on a typical child death review team, it's listed in the bill who's mandated to be there. But the typical ones is the county coroner, EMS, physicians, children and youth, public health, law enforcement, district attorney's office, sometimes schools, and anybody else from the community that the community feels will be helpful in understanding why children die. Initially, when this bill was passed, the county commissioners were tasked with nominating certain members of the team, which did happen. And we've had a very active and robust team here in Lebanon under Janet's leadership for the last number of years. Janet, talk a little more about the Lebanon County team, and then we can get back to about specifics of what we've accomplished.
The Lebanon County team meets quarterly. We will bring up extra meetings if we need based on caseload, but typically it's quarterly. We receive information from the state on the deaths of children that were Lebanon County residents. Includes death certificate, traffic accidents, birth records, whatever's applicable to the death. That we kind of all come together to discuss those. We have a reporting database that we enter all this information into. It's collected, and there is an annual state report put out that kind of shows the frequency of deaths and what circumstances they were. And I kind of just went back to our database, and in 2008, which is when our database became active, we reviewed 39 cases. I believe that was high because of some catch-up we were doing from previous years before we had the database reporting system. But in 2009, we reviewed 12 cases, 2010, 20 cases, 2011, 12 cases, 2012, 14 cases. From what I could gather, from 2005 to 2013, we reviewed 99 cases in all. Leading cause of those deaths were from a medical situation. Second leading cause was motor vehicle accidents and other transportation type accidents. Largest percentage of the age group for those deaths were males between 18 and 19 years old. We do review cases up to 21 years old. The breakdown of the different types of fatalities that we investigate, there was 57 natural deaths, 22 accidents, 6 suicides, 2 homicides, 8 were listed as unknown, and 4 were listed as still undetermined or pending. The leading cause of natural death, typically in infants, this occurs of prematurity, congenital diseases, and cardiovascular diseases. So that's kind of the breakdown of some of the stuff that we sit around the table and talk about at our meetings. We have a pretty robust team. It includes EMS, healthcare, social services and mental health, law enforcement, and a few other individual or organizations that deal with children, like Lebanon County Safe Kids and Lebanon High School also sends a representative to our meetings. This handout, is your handout packet?
Yes.
This handout is in your packets. It gives the breakdown, the numbers and everything else. So that's pretty much just kind of our activity.
So just at a typical team meeting, everybody will present any information they have about the child. This is all done in confidence, and confidentiality waivers are signed by everybody who attends. And then a story emerges as to how or why the child died, and then we discuss prevention.
Obviously, the coroner is a very instrumental part of us putting the pieces together with the autopsy findings and stuff that he can relay at the meeting. So Jeff's here because he's very important to the team, even though he doesn't want to say anything.
The only thing I wouldn't have a part of the natural deaths, somebody who had maybe a brain tumor, that's a natural case that was taken care of by the family physician or pediatrician, I wouldn't have any involvement in that. But all the other cases I would have involvement with.
We review all deaths of children who are residents of Lebanon County, even if they died outside the county.
Do your statistics include children from other counties that died in Lebanon County?
No.
No, yeah, and the hardest case to try to review is, a child that died in Schuylkill County in a motor vehicle accident, but they're a resident of Lebanon County, and we don't have any of those team players at our meetings. So there is a formal records request form that we can send out to various hospitals and different agencies to try to collect information according to Act 87, which is also in your handouts if you want to look into that. That is allowable under HIPAA to relinquish those documents. Everything gets shredded after a meeting, and we have all the information needed to do the data reporting on it. Some of the accomplishments that we're pretty proud of, if you are aware of Cribs for Kids, it's a program that hands out pack and plays to families in need that don't have a safe place for their child to sleep. The Family Support Services from Hyman Kaplan Pavilion, or GSH, host that program for Lebanon County. And they've actually been very active. I believe in 2012 they gave out like 40 cribs. Because of some of that activity from our different community partners and wanting to support their programs, I applied for a grant through the Department of Health this year. I applied for about $4,900, and I was awarded $4,317.65 from the Department of Health, and we utilized that to buy bicycle helmets, safety seats for children in vehicles, and pack and place to support the Cribs for Kid program.
Suicide, as you know, is an issue that is present and needs to be addressed. In Lebanon County, there was a suicide prevention task force in the mid-1990s, but it had kind of, the attendance was down and it wasn't meeting regularly. But about 5 years ago, after reviewing a number of suicide cases on the Child Death Review team, there was a group of us that said we need to get this group back up and running in Lebanon County. And so from the work and the findings of our Child Death Review Committee, we then restarted the Lebanon County Suicide Prevention Task Force, which is now known as TIPS, Training and Information for the Prevention of Suicide. So it's kind of taken on a life of its own, but many of the players who are on the task force are also involved with Child Death Review. It's run currently jointly by MHED, and the Mental Health Association of Lebanon. We've provided training for schools. They've applied for grants to get signs of suicide curriculum for schools, and they've been working on getting the word out there about support groups for survivors. So, just so a lot of these ideas are current ongoings aren't necessarily run by Child Death Review team members or in the name of Child Death Review right now, but the origin and genesis came from the discussions at the table. The Child Death Review, as a community, we got together and said we need to do something, and that's what Child Death Review is about.
In your handouts, you also have some information about our TIPS team, which is our suicide prevention team. There are posters that we hang with little tear-off slabs at the end on a number you can call if you yourself or you know someone who is showing some suicidal ideation.